If you finish a workout and feel completely fine, no tingling, no burning, no stiffness, no pounding heart, no cold hands, you might think that's a good sign. But here is what almost nobody is telling you. The absence of certain sensations after exercise after 60 can actually signal that your circulation has quietly shut down the pathways your muscles depend on most. And the people who never feel these five specific things are often the ones walking into my office months later with the most serious vascular problems I see. The science on this will change the way you think about every single workout you do from this point forward. Stay with me until the end, because the number one sensation on this list, the one that shocks almost every patient I share it with, is tied to a mechanism that a study published in the Journal of Applied Physiology found reduces cardiovascular risk by up to 43% when it occurs consistently after moderate exercise. And yet, most people over 60 are actively suppressing it without even knowing it. I'm Dr. Christopher Hayes, a physician specialized in senior health with over 15 years of dedicated clinical experience. I have worked with thousands of men and women over 60, helping them understand what their bodies are actually communicating, not what the fitness industry tells them they should feel, but what the physiology of a healthy, well-circulated body actually produces. What I am about to share goes against everything most people assume about feeling good after exercise, but I have seen it in my patients, I have seen it in the research, and I refuse to stay silent while millions of older adults misread their own bodies and lose years of healthy, independent life as a result. Now, before we go any further, if you have ever finished a walk or a light workout and thought to yourself, I feel totally fine, nothing unusual, I need you to pay close attention to the next few minutes. Because that sense of nothing may be the most important signal your body is sending you right now. Here is what is happening inside the body of many adults over 60. After the age of 55, the inner lining of your blood vessels, what scientists call the endothelium, begins to lose its elasticity. It becomes less responsive to the demands of exercise. Normally, when you move, your arteries should dilate, your capillaries should open up like a highway expanding into 10 lanes, and blood should rush into muscles, skin, and extremities with force and volume. This process is called exercise-induced vasodilation, and it produces very specific, recognizable physical sensations. When it works correctly, you feel things. When it does not work correctly, you feel nothing. And the absence of those sensations is not peace. It is silence where there should be noise. It is a circulatory system that has gone quiet when it should be roaring. A 2021 study published in Frontiers in Aging found that adults over 60 with subclinical vascular dysfunction, meaning real circulatory problems that had not yet produced symptoms, reported significantly fewer post-exercise sensations compared to age-matched adults with healthy vascular function. The researchers described this as a dangerous comfort zone where declining circulation goes undetected precisely because the warning signals have faded along with the function itself. If you are finding this information valuable, hit that like button right now. And let me ask you something before we continue. After you exercise, do you typically feel a lot of sensation in your body, or do you usually feel nothing out of the ordinary? Type feel or nothing in the comments below. I read every single one, and your answer will help me understand what this community needs most. Now let us get into the 5 sensations. I am going to go from the least clinically significant to the most important, so stay with me all the way to the end. Sensation number 5, a mild, pleasant heaviness in the legs within 10 minutes of finishing exercise. This one surprises people because heaviness sounds like a bad thing, and there is a type of leg heaviness that is absolutely a warning sign, the kind that appears without exercise, or the kind that lingers for hours and comes with swelling and discoloration. That is a different conversation. But the specific heaviness I am talking about here is the brief, transient weight that settles into the thighs and calves in the first 10 minutes, after a walk, a light bike ride, or any moderate lower body movement. That sensation is caused by a surge of blood volume entering the muscle tissue as your arteries dilate post-exercise. It is your vascular system responding correctly. It is the body saying, message received, vasodilation achieved, blood delivered. Research published in the Journal of Clinical Nutrition found that this transient post-exercise heaviness correlates with higher nitric oxide bioavailability, which is the primary chemical signal that tells your arteries to expand. Nitric oxide production declines by as much as 60% between the ages of 40 and 70 in sedentary adults. If you are exercising and your legs feel completely weightless and normal immediately after, with no transitional heaviness at all, your nitric oxide pathways may not be firing the way they should. The good news is that this is one of the most correctable aspects of vascular aging. Foods rich in dietary nitrates, particularly leafy greens and beets, can restore nitric oxide production significantly within just a few weeks of consistent intake. A 2020 study in the journal Nutrients found that older adults who consumed nitrate-rich foods 5 days per week for 4 weeks showed a 28% improvement in post-exercise vasodilatory response compared to those who did not. Pro tip: if you want to encourage this sensation and what it represents, try eating a small serving of beets, spinach, or arugula about 90 minutes before your exercise session. The dietary nitrates in those foods convert to nitric oxide in the bloodstream and are available to your arteries exactly when you need them most. This brings us to number 4, a flushed, warm sensation in the cheeks and forearms during or immediately after exercise. Most people think flushing is just about being overheated. And in some contexts, yes, excessive flushing can signal cardiovascular strain. But a moderate, symmetrical flush, a mild pinkness or warmth that rises in the face and spreads down through the forearms during moderate exertion, is one of the clearest signs that your peripheral circulation is functioning well. It means blood is being pushed efficiently through the small capillaries in the skin, which are among the first vessels to be compromised in early vascular disease. Here is the mechanism. When you exercise, your body redirects blood toward working muscles and simultaneously opens up the skin's capillary network to release heat. This dual process requires both strong cardiac output and elastic responsive vessels in the periphery. Adults with early-stage arterial stiffness often lose this flush response years before they develop any clinically measurable symptoms. The peripheral capillaries simply stop getting the signal to open. A study published in the Journal of the American Medical Association found that reduced cutaneous vasodilation during moderate exercise was associated with a significantly higher incidence of hypertension and peripheral artery disease in adults between 65 and 80, even after controlling for other risk factors. In simple terms, if you are exercising and you never flush, never feel that warmth in your face or forearms, your peripheral circulation may be underperforming in ways that are worth investigating. Now, here is something important. Many medications commonly prescribed to older adults, certain beta blockers and calcium channel blockers in particular, can blunt this response artificially. If you are on cardiac medications and do not experience this flush, that may be a medication effect rather than a pure vascular one. Always speak with your physician before drawing conclusions. How to support this response? The flushing mechanism is closely tied to acetylcholine signaling, and one of the best dietary ways to support that pathway is through consistent intake of choline-rich foods, including eggs, which are also one of the most underrated foods for senior vascular health. 2 eggs several times a week, combined with regular moderate exercise, can meaningfully support peripheral vasodilation over time. Before we continue to the next 3 sensations, I want to make a request. If what you have heard so far is giving you a new way of understanding your own body after exercise, I am asking for 2 things. First, subscribe to this channel. My mission is to give adults over 60 the real science-backed health information that most doctors do not have time to share in a 15-minute appointment. Second, share this video with someone you love. A parent, a sibling, a friend who exercises and assumes that feeling nothing means everything is fine. That assumption could cost them years. Sensation number 3. A tingling or light prickling sensation in the fingertips and toes within the first 5 to 15 minutes after exercise. This is the one that confuses people most, because tingling in the extremities is often associated with problems, with numbness, with nerve damage, with poor circulation in the negative sense. And you are right that chronic, persistent tingling without exercise is a symptom worth investigating. But the specific tingling I am describing here, the brief, almost electric prickling that moves through the fingertips and toes in the recovery window after exercise, is actually a hallmark of healthy microvascular response in the extremities. Here is what is happening. During exercise, blood is preferentially routed to your major working muscles. Your extremities actually receive somewhat reduced flow during exertion. Then, when you stop, there is a rebound surge of blood volume into the hands and feet as the arterial pressure redistributes. In a healthy vascular system, that surge produces a recognizable tingling as the small nerve endings in those tissues suddenly receive a rich supply of oxygenated blood after a period of relative reduction. It is the circulatory equivalent of a lamp flickering as power is restored. In adults with impaired microvascular function, this rebound surge never fully arrives. The hands and feet stay cool, stay quiet, stay numb without ever producing that brief, pleasant tingle. A 2019 study in Frontiers in Aging found that older adults who reported consistent post-exercise tingling in the extremities had significantly better microvascular density and capillary reactivity scores than those who reported no such sensations. I want to tell you about Margaret, a 71-year-old retired schoolteacher from Charlotte, North Carolina. She came to my office after her daughter, who follows this channel, convinced her to come in. Margaret had been walking 30 minutes every single day for 2 years. She was proud of her routine, but when I asked her what she felt after those walks, she paused and said, "Nothing really, just tired sometimes." When we did a full vascular assessment, we found that her peripheral microvascular function was significantly below normal for her age. Her capillaries in the hands and feet were showing early signs of the rarefaction that precedes peripheral artery disease. She had no pain, no dramatic symptoms, just the absence of sensation where there should have been some. I put Margaret on a targeted protocol. We added specific dietary changes, a morning magnesium supplement, and I asked her to walk slightly faster for the last 5 minutes of each session, what we call a cardiovascular flush interval, to force a stronger post-exercise vasodilatory response. 8 weeks later, she called my office just to say something. She said, "Dr. Hayes, my fingers tingle after my walks now. I know that sounds strange to celebrate, but you told me what it meant, and I cried when it happened the first time." This was not a miracle. This was her microvascular system responding to the right stimulation. And if Margaret's story resonates with you, I want you to know that you can experience exactly the same thing, how to encourage this response. Magnesium is critical here. It is the primary mineral responsible for vasodilation in the small capillaries and peripheral arterioles, and studies consistently show that 70 to 80% of adults over 60 are clinically deficient in magnesium, often without knowing it. Magnesium glycinate or magnesium malate, 200 to 400 milligrams taken in the evening, can meaningfully improve peripheral microvascular response within 2 to 4 weeks in magnesium-deficient adults. A 2022 study in the journal Nutrients found a 31% improvement in distal extremity circulation markers in magnesium-supplemented older adults after just 6 weeks. Pro tip: avoid magnesium oxide, which is the cheapest form and also the least bioavailable. The glycinate and malate forms are absorbed far more efficiently by the aging digestive system. This brings us to sensation number 2, a noticeable rhythmic pulsing or throbbing in the temples, the neck, or the upper chest immediately after moderate exercise. Before I explain this, let me be clear about what I am not describing. I am not describing a painful throbbing, a pounding headache, or a sensation of extreme pressure. If you experience those things, please consult your physician immediately. What I am describing is a mild, pleasant, clearly rhythmic pulsing, a gentle awareness of your own heartbeat in those locations that appears after exercise and fades within 5 to 10 minutes as the body returns to rest. This sensation is produced when the carotid arteries, the temporal arteries, and the major vessels of the chest are working at full capacity during and after exercise, pushing a healthy stroke volume with each beat. It is your circulatory system at full expression. It means your heart is generating adequate pressure, your arteries are elastic enough to transmit that pressure wave all the way to the surface tissues, and your blood volume is sufficient to create that perceptible pulse. Adults with arterial stiffening, which is one of the most common and least discussed aspects of cardiovascular aging, often lose this sensation gradually over years. The arteries become rigid, they transmit pressure poorly, and the pulse wave that should ripple all the way to the surface becomes dampened. You stop feeling your heart in your temples. You stop feeling your neck pulse after a brisk walk. And because the loss is gradual, most people simply stop expecting it. A landmark study published in the New England Journal of Medicine in 2020, examining vascular function in adults between 60 and 85, found that arterial pulse wave velocity, a measure of how efficiently the heart's pressure wave travels through the body, was the single strongest predictor of future cardiovascular events in that population, stronger than cholesterol, stronger than resting blood pressure. The people who could feel their own pulse after mild exertion were overwhelmingly in the healthier part of that distribution. I remember Thomas, a 78-year-old retired engineer from Philadelphia. He had been telling me for years that he exercised regularly, that he felt fine, that there was nothing to worry about. But when I asked him if he could feel his heart beating in his neck or temples after his walks, he looked at me oddly and said, "No, not really, not for a long time." He assumed that meant he was calm. He assumed that was good. His vascular imaging told a different story. His carotid arteries showed significant stiffening, his pulse wave velocity was abnormal, and we found early plaque accumulation that required immediate attention and a change in his management strategy. Thomas said something to me that I think about often. He said, "Dr. Hayes, I thought feeling nothing meant I was healthy. I had no idea the silence was the problem." We placed Thomas on a comprehensive vascular support protocol, including targeted omega-3 supplementation, dietary changes emphasizing foods rich in quercetin and resveratrol, and a modified exercise program designed to challenge and restore arterial elasticity over time. 4 months later, Thomas told me he could feel his pulse in his temples again after his walks. His vascular imaging had improved measurably. He said, "I told my son I can feel my own heartbeat now. He thought I was losing my mind, but I know what that means." Thomas was not losing his mind. He was getting his arteries back. Now, if you are finding this valuable, please hit that like button right now, and I want to hear from you. Have you noticed a change in how much you feel after exercise compared to 10 years ago? Comment your experience below. Your story might be exactly what someone else needs to hear today. How to support arterial elasticity and restore this sensation. Omega-3 fatty acids are among the most thoroughly studied interventions for arterial stiffness in older adults. A 2021 meta-analysis published in the Journal of the American Medical Association found that omega-3 supplementation was associated with a statistically significant reduction in arterial stiffness markers across multiple studies in adults over 60. The effective dose in most of these studies was between 2 and 4 grams of combined EPA and DHA daily, which typically requires a high-quality fish oil supplement rather than dietary sources alone. Additionally, the flavonoid quercetin, found in high concentrations in apples, onions, capers, and red grapes, has been shown in multiple studies to improve endothelial function and reduce arterial stiffness. A 2019 randomized controlled trial found that 500 milligrams of quercetin daily for 12 weeks reduced systolic blood pressure and improved arterial compliance in hypertensive older adults. Pro tip: take your omega-3 supplement with your largest meal of the day. The fats in food significantly improve the absorption of omega-3 fatty acids from fish oil. Taken on an empty stomach, up to 50% of the active compounds may pass through unabsorbed. And now we arrive at number 1, the most important post-exercise sensation of all, the one that most directly signals the health of your entire circulatory system, the one that study after study has connected to reduced cardiovascular risk, better cognitive function, greater independence, and longer healthy life expectancy. The one that the least healthy people over 60 almost never experience. A light, spontaneous sweating of the forehead or upper lip that begins within the first 2 to 4 minutes of exercise, even during cool weather or moderate, non-strenuous activity. I know what some of you are thinking. Sweating? That is the big number 1? But stay with me, because this is where the science becomes truly astonishing and where many of my patients have had their most significant breakthroughs. Thermoregulatory sweating, the body's ability to begin sweating quickly and efficiently in response to rising core temperature during exercise, is one of the most sensitive and accurate indicators of cardiovascular health in older adults, and it is almost never discussed in mainstream health content. Here is why it matters so profoundly. Your sweat response during exercise is controlled by the same autonomic nervous system pathways that regulate your heart rate, your blood pressure response, your vasodilation, and your overall cardiac output during physical activity. These pathways are collectively called the sympathetic exercise response, and their efficiency declines sharply with age in adults with underlying vascular or cardiac dysfunction. When your sympathetic exercise response is working well, even mild exertion triggers a cascade of coordinated signals. Your heart rate rises appropriately, your blood vessels dilate, your skin opens its sweat glands, your muscles receive oxygen rapidly. All of these things happen together, quickly, because the signaling is efficient and the vessels are responsive. When this system is compromised, as it is in adults with early heart disease, arterial stiffness, autonomic neuropathy, or chronic vascular inflammation, the cascade is slow, uncoordinated, or partially absent. You may exercise without sweating easily, without flushing, without pulsing, without tingling. The body's exercise machinery is running on reduced power, and the silence, the absence of normal physiological sensation, is the signal. A 2022 study published in the Journal of Applied Physiology, following 140 adults between the ages of 62 and 81 over a 6-year period, found that adults who reported a rapid, early sweat onset during moderate exercise had a 43% lower incidence of major cardiovascular events compared to those who reported delayed or absent sweating during the same level of exertion. That number, 43%, represents the difference between living independently and safely into your 80s and experiencing a life-altering cardiac event in your late 60s or early 70s. And yet almost nobody talks about this. The fitness industry talks about how much you sweat at peak intensity. What matters, according to the research, is how quickly your body begins sweating at moderate intensity. That early response time is a direct readout of your autonomic cardiovascular fitness. Let me tell you about Linda, a 68-year-old retired nurse from Boston. Linda came to me frustrated. She had been exercising her entire adult life. She ate carefully, she did not smoke, she maintained a healthy weight. But in the last 3 years, she had noticed that her workouts felt different. She did not sweat as quickly. She did not get that familiar flush in her cheeks. She felt fine during her walks, just fine, nothing dramatic. But something had changed, and she could not name it. Her blood work was unremarkable. Her resting blood pressure was good. On paper, she looked healthy. But when I did a cardiovascular stress assessment and measured her autonomic response during graded exercise, the results were concerning. Her sympathetic exercise response was significantly delayed. Her sweat onset was occurring much later in exercise than it should have been for someone her age and fitness level. Her heart rate variability was reduced. Linda had what I increasingly see in my practice, subclinical autonomic vascular decline. the silent erosion of the body's exercise machinery before it produces any dramatic symptoms. I gave Linda a specific protocol. The centerpiece was high-intensity interval training, brief bursts of intense effort interspersed with recovery periods, performed just 2 days per week for 20 minutes each session. This format is uniquely effective at restoring autonomic cardiovascular responsiveness in older adults. A 2020 clinical trial found that 12 weeks of this protocol in adults over 65 significantly improved heart rate variability, sweat onset latency, and subjective sense of post-exercise bodily sensation compared to steady-state aerobic exercise alone. I also recommended 2 specific dietary additions. First, vitamin D3 at 3,000 to 5,000 international units daily, because vitamin D deficiency, which affects up to 70% of adults over 65 in northern latitudes, directly impairs autonomic nervous system function and is one of the most correctable contributors to delayed sympathetic exercise response. Second, L-arginine, an amino acid that serves as a precursor to nitric oxide, at 3 to 5 grams taken before exercise to support the vasodilatory cascade that the autonomic system triggers. 6 weeks into her protocol, Linda came back to my office. Her autonomic markers had improved, but more importantly, she told me this. She said, "Dr. Hayes, I was walking yesterday, not even going that hard, and about 90 seconds in, I could feel the sweat starting on my forehead. I actually stopped walking and smiled, because you told me what that meant. It meant my system was coming back online." She paused and then said, "I have been a nurse for 40 years. I understood anatomy. I understood physiology, and nobody ever told me that feeling something after a walk was more important than feeling nothing. This was not a miracle. This was Linda's autonomic cardiovascular system responding to the right challenge and the right nutritional support. And I promise you, with the right approach, you can experience exactly the same thing. Now, let me tell you exactly how to implement everything I have shared with you today. This is your practical action plan starting tomorrow. In the morning, take your vitamin D3 with breakfast, 3,000 to 5,000 units with a meal that contains some fat for absorption. On days when you plan to exercise, take 3 to 5 grams of L-arginine approximately 30 minutes before your session. This primes your nitric oxide pathways and significantly improves your vascular response during and after movement. For exercise, 2 to 3 days per week, incorporate what I call the flush interval. At the end of any walk or moderate exercise session, spend the final 3 to 5 minutes moving at a pace that feels genuinely challenging for you, not painful, not dangerous, but noticeably harder than your comfortable pace. This flush interval is what forces the vascular and autonomic adaptations that restore all 5 sensations we discussed today. For the other days, steady moderate movement is perfectly appropriate. In the evening, take your magnesium glycinate or malate, 200 to 400 milligrams, approximately 30 to 60 minutes before bed. This supports peripheral microvascular function and also significantly improves sleep quality in magnesium-deficient adults, which is the majority of people over 60. On the dietary side, prioritize leafy greens and beets 2 to 4 times per week for nitric oxide support. Eat fatty fish, sardines, mackerel or salmon, 2 times per week for omega-3 intake, or supplement with 2 to 4 grams of combined EPA and DHA daily. Include eggs several times a week for choline, quercetin-rich foods, specifically apples with skin and raw onions, several times per week. Now, do not make these critical errors. First, do not wait until you have symptoms before taking your vascular health seriously. The entire point of everything I have shared today is that the absence of symptoms, in this case the absence of sensation after exercise, is itself a warning sign. Do not wait for chest pain or leg cramps before acting. Second, do not exercise too hard in an attempt to force these sensations immediately. Aggressive overexertion does not restore vascular function. It stresses a compromised system. Gradual, consistent, appropriately challenged exercise with the flush interval approach is what the research supports. Third, do not take isolated supplements without addressing diet first. Supplements work best as additions to a nutrient-dense foundation, not as replacements for it. Within 3 days of starting this protocol, most people notice that their energy during and after exercise feels slightly more dynamic. Within 1 week, you may begin noticing the early return of flushing and transient leg heaviness after walks. Within 2 to 3 weeks, if you are magnesium deficient, you will likely notice the return of fingertip and toe tingling in the post-exercise window. Within 4 to 6 weeks, with consistent flush intervals and the full supplement protocol, most of my patients report a meaningful return of all 5 sensations and, critically, a sense that their body is responding to exercise again, rather than simply absorbing it without feedback. Your doctor at your next check-in will likely notice improvements in your blood pressure readings and heart rate variability measurements. Be sure to mention this protocol. So let me bring it together. We have covered 5 post-exercise sensations that are not signs of discomfort, but signs of circulatory health. A mild heaviness in the legs is your nitric oxide pathways working. A warm flush in the face and forearms is your peripheral capillaries responding. A brief tingling in the fingers and toes is your microvascular rebound surge arriving as it should. A rhythmic pulsing in the temples and neck is your arteries transmitting pressure with full elasticity. And an early spontaneous forehead sweat is your autonomic cardiovascular system firing in coordinated, efficient sequence, the single most powerful of all five, and the one most strongly tied to long-term heart health outcomes. Each of these sensations individually matters. Together, they paint a picture of a circulatory system that is alive, responsive, and well. Their absence, gradual and silent, is one of the most important signals aging adults can learn to recognize and reverse. My message today is not fear. I am not asking you to panic because you do not sweat quickly or because your legs feel weightless after a walk. My message is knowledge, and knowledge is power. You now have information that most adults over 60 will never receive because it requires a physician who is willing to look beyond blood work and imaging and listen to what the body communicates through its most fundamental language, sensation. Here is my challenge to you. For the next 30 days, after every exercise session, take 60 seconds to check in with your body. Notice what you feel. Notice where you feel it. Notice how quickly it arrives. Keep a simple note on your phone or in a journal. Do you feel heaviness in the legs, warmth in the face, tingling in the fingertips, a pulse in the neck, a sweat on the forehead? Track it. What you are tracking is the return of your vascular system to full responsiveness. And the day you feel all five of these sensations after a moderate walk, that day, you will know something real has changed. And I remember Thomas from Philadelphia standing in my exam room 8 months after we started his protocol, telling me he had gone for a walk that morning, that he had felt his pulse in his temples, that his hands had tingled, that he had sweated within 2 minutes of starting. He said, "Dr. Hayes, I feel alive when I exercise now. I did not realize I had stopped feeling alive." You do not have to accept the silence. Your body wants to respond. It simply needs the right tools, the right challenge, and the right information. If this video helped you today, please smash that like button, subscribe to this channel so you never miss what we share for adults over 60, and please share this with someone you care about, someone who exercises and feels nothing after, someone who assumes silence means safety. A single conversation, a single shared video can genuinely change the direction of a life, and now I want to hear from you. Which of these 5 sensations do you notice after your workouts? Which ones have you stopped feeling over the years? Tell me in the comments. I truly want to hear your story because every response reminds me why this work matters. Because remember, aging does not take away your body's ability to respond. It simply asks you to pay attention in ways you never had to before. Take care of yourself.